What are alternatives to diazepam for anxiety? When it comes to managing anxiety, especially for those dealing with post-traumatic stress disorder, many people wonder about alternatives to diazepam. Diazepam, commonly known as Valium, is a benzodiazepine that can provide short-term relief for anxiety symptoms. However, it is generally not recommended for long-term use due to risks like dependency and potential worsening of PTSD symptoms. Thankfully, there are several effective alternatives to consider. One of the most commonly prescribed alternatives is selective serotonin reuptake inhibitors, or SSRIs. Medications like sertraline, known as Zoloft, and paroxetine or Paxil, are FDA-approved for treating both PTSD and anxiety disorders. These medications work by regulating serotonin levels in the brain, which can help improve mood and reduce anxiety over time. They are often considered first-line treatments due to their safety and effectiveness. Another option is serotonin norepinephrine reuptake inhibitors, or SNRIs. Venlafaxine, marketed as Effexor XR, has shown effectiveness in reducing symptoms of PTSD and anxiety in clinical studies. It is sometimes used off-label for these conditions. However, it is important to monitor blood pressure as this medication can increase it. There are also other antidepressants that may be prescribed off-label for anxiety and PTSD. Nefazodone, imipramine, and phenelzine are examples of medications that can affect neurotransmitters in different ways. These may be considered when SSRIs or SNRIs are not suitable for a patient. Alpha-1 adrenergic blockers, such as prazosin and doxazocin, can be helpful as well. These medications are often prescribed off-label to reduce nightmares and improve sleep in individuals with PTSD, which can indirectly alleviate anxiety symptoms related to sleep disturbances. Additionally, anticonvulsants and mood stabilizers like topiramate and lamotrigine have shown promise in reducing hyperarousal and core PTSD symptoms, including anxiety. However, more research is needed in this area. Beyond medication, non-pharmacological approaches can also be beneficial. Evidence-based psychotherapies, such as cognitive behavioral therapy, prolonged exposure therapy, and eye-movement desensitization and reprocessing, have proven effective for managing PTSD and anxiety. It's important to note that benzodiazepines may interfere with the benefits of these therapies. In summary, while diazepam may provide short-term relief for anxiety, it is not advisable for long-term use in managing PTSD. Safer and more effective alternatives include SSRIs, SNRIs, certain antidepressants, alpha-1 blockers, and anticonvulsants, often in combination with therapy. Always consult with a healthcare professional to tailor treatment to individual needs and ensure a balance of benefits and risks.